Hey guys, welcome back to Dr. O'Donovan, Medicine Made Easy, and in today's video we're going to be looking at something called black hairy tongue or hairy tongue, also known as lingua villosa nigra, which is an unusual but harmless condition characterised by this hairy enlargement and discoloration of something called the filiform papilla. The filiform papilla are these tiny little conical bumps, and they're found on the surface of the front 2/3 of the tongue where there are no taste buds. And hairy tongue is due to defective shedding of the surface cells. So let's just take a little brief look at the anatomy. So here you've got the front 2/3 of the tongue, and the papilla that I'm interested in are the filiform papilla. And what happens is the abnormal filiform papilla prevent normal cleaning and debridement of the tongue, so debris accumulates in these little grooves here. Bacteria and yeasts overgrow and they make something called porphyrins. So porphyrins are essentially deeply coloured organic compounds which might contribute to the discoloration of the tongue. So let's move on now and just talk briefly about what causes it. So I'm going to split this down into two main things. One is medication and one is poor oral hygiene. So the first thing to note with medication, which is a common cause of hairy tongue, is that a range of medications are linked to it, and those are things like penicillin, erythromycin, tetracycline, doxycycline, lansoprazole and bismuth. However, there are other factors, so that's one of the main causes, but there are other factors that cause it, and these are things such as poor oral hygiene, and there's a number of things that have been linked to hairy tongue. So the first one is alcohol, so excessive alcohol intake can cause this. It can also be caused by tobacco, and that could be both smoked tobacco, so smokers or people who chew tobacco. It can be due to generally poor oral hygiene, so not cleaning the oral cavity. It could also be due to things such as cocaine use, and in a couple of people it can be due to radiation therapy or general dehydration or beverages such as coffee. So now let's move on and take a quick look at the clinical features of hairy tongue, and you're going to see lots of photos here, so hopefully that'll be interesting. Filiform papilla can grow up to about 18 millimeters in length, and we talked about that earlier, which gives them this sort of hairy appearance, and all of these photos here show examples of hairy tongue. The tongue then becomes discoloured. Usually it's a brown or even here like a darker black colour, but it can also be yellow and green, which has been reported in the literature, and it typically affects the back surface of the tongue, whereas the tips of the tongue, so as you can see here, and the sides of the tongue are less affected. And that's important because we're going to talk about some important differentials later on. In terms of the diagnosis, a clinical diagnosis, so you really want to take a good history and do a thorough exam, because there are other issues such as in these two photos which are not hairy tongue, but they could be thought of as important differential diagnosis. The first one here is oral candida. Now oral candida is almost always sensitive or painful, and it will usually affect other parts of the mouth in addition to the top of the tongue. Similarly, you need to be aware of other conditions. So this condition here is oral hairy leukoplakia, which is basically an Epstein-Barr virus infection of the tongue, and you get this sort of shaggy or corrugated appearance on the lateral aspect of the tongue. If you've got any uncertainties about diagnosis and you don't think it's hairy tongue like you saw in this photo or these photos here, then you can be thinking of some other potential investigations. Those would be things like swabs for bacteria and fungal scrapings, or even biopsy if you were thinking something like an oral cancer. But obviously in that case you'd be wanting to refer to specialists. In terms of treatment of oral hairy tongue, well, hairy tongue is usually self-limiting, and if desired, treatment options can include a couple of things. So the first one that we're going to talk about briefly is just stopping the offending agent, so things like the drugs that are causing it, which we talked about earlier. So we'll put here stopping the drugs. You also want to encourage good oral hygiene, so making sure people are cleaning their mouth regularly, as well as stopping smoking if necessary, or cutting down on alcohol intake. You can also encourage gentle debridement of the tongue, which you can see in this photograph here, and that can be using a tongue scraper or a soft toothbrush, as well as a solution containing something like hydrogen peroxide. And you can also encourage the patient to use antiseptic mouthwash, and if they have something like candida, which we saw back in this photo up here, you could make sure that they're treated for oral candida if it's present. And you can also be using things like a topical retinoid, however that will be more down to specialist input. I hope you found the video useful, and before we move on to the quiz, it's just to say that if you did enjoy it, please remember to like, comment and subscribe to the channel if you haven't done so already. It's always great to hear from people, so please leave a comment in the comment section below. So now we're just going to move on quickly and have a look at this quiz. So I've included 4 photos here of different tongues, and I'd like you to tell me in the comments box which one you think is a hairy tongue. So is it 1, 2, 3 or 4? And I'll get back to you with the correct answer, as well as the answers for what all of these are. If you do know what these are, please do let me know. It'd be really good to hear from you, and thanks again for watching. Until next time, bye.